For the next topic, we're just going to cover a few urinary system disorders to finish out Chapter 25. Bedwetting is also known as nocturnal, meaning nighttime, enuresis, and this is a failure to respond to the signs of micturition. So you need to go, but you don't wake up to go do it voluntarily, so you do it involuntarily. And of course, that's normal when you're extremely young before you have full control over those types of things, but then it does extend later into childhood or even adolescence in some cases. Stress incontinence. This is incontinence where you are urinating when you don't want to, urine leakage that occurs when you laugh or cough. Urinary retention. This is where you can't fully empty the bladder, and this is especially seen in men who have an enlarged prostate gland. So the prostate sits just inferior to the bladder, and we'll be covering that more. You've seen that already if you've done the anatomy video for the urinary system, and we'll be seeing the prostate a whole lot more when we do the reproductive anatomy. So as men get older, prostate tends to enlarge, and that presses up against the bladder, and it can block the bladder from being able to fully empty of urine. Kidney stones, very painful. And ask anybody who's ever had one. I haven't. My wife has had them, and she was in more pain, I think, than when she was in labor for both of our daughters. So these can be extremely painful. These tend to form in the renal pelvis. And what is a kidney stone? It's actually a crystal of some solute in the urine. The solute becomes so concentrated that the solute forms crystals, and those become what are known as kidney stones. So these can form from calcium, magnesium, or uric acid. So uric acid, again, that is a nitrogenous waste, which means it has nitrogen atoms in it. And uric acid is formed from the breakdown of DNA and RNA. So if any of those solutes become too concentrated in the renal pelvi, they can interact with each other and form crystals, kind of like salt crystals. You know, if you had a glass of salt water sitting out on your kitchen counter and you just let the water evaporate, you're going to see crystals of the salt form in that water. Same thing with sugar. If you had a glass of sweet tea or something sitting out on the counter for a long time, eventually the water would evaporate out and the sugar in there would form crystals as well. So the same thing can go on in the renal pelvis. One thing that can trigger the formation of kidney stones is dehydration. So if you are one of these people who never drinks anything, that can cause your urine to be too concentrated. Your ADH is screaming to reabsorb water out of the collecting ducts before it makes it to the renal pelvis. So your urine becomes more concentrated. The more concentrated those solutes are in there, the more likely they're going to form stones. Larger stones can block the ureter, cause pressure, and lots of pain. Other things that can trigger kidney stone formation: chronic bacterial infections. Chronic means long lasting. You just, instead of getting over it, you kind of have this bacterial infection that's very long lasting or kind of coming and going. Retaining your urine, if you don't allow yourself to pee as frequently as you need to, that could trigger kidney stone formation as well. Increased calcium ion concentration of the blood, and actually an increased pH of the urine above normal levels can lead to crystals forming as well. Diabetes. Now, we've talked about diabetes already, but just to kind of review, the term diabetes actually refers to an excretion of an excessive urine volume. That's actually what diabetes means, because when these conditions were first identified, the first sign, symptom of something going wrong was increased urine output. And earlier in the semester, we talked about Diabetes insipidus versus diabetes mellitus. Insipidus, something is insipid, it lacks flavor. believe it or not, these terms are referring to the flavor of the urine. So diabetes insipidus, increased urine output, but it's not sweet. Diabetes mellitus, mellitus is actually a Latin term for sweet. Diabetes mellitus patients can't control their blood glucose levels. Excess blood glucose leads to excess glucose in the urine. All of the glucose can't be reabsorbed in the nephrons, and so they wind up with glucose, sugar in the urine. So the urine would actually have a sweet taste, which again, I know that's pretty gross to think about. DI, or diabetes insipidus, just to review, that's due to a failure to produce ADH and secrete it from the posterior pituitary, and therefore you don't reabsorb proper amounts of water through the collecting ducts, and so your urine output is going to be too high. Diabetes mellitus is due to either, in the case of type 1, you're not producing insulin in the pancreas and those pancreatic islets, and so therefore many cell types in the body don't take up glucose, so you have high levels of glucose in the blood, and that leads to increased urine output. Or in type 2, this is the more common condition that we have in the United States today. This is where insulin is produced, but cells don't respond to it properly, so that also leads to high glucose levels in the blood and glucose in the urine, which leads to a high urine output. And again, just to review, high glucose levels in the urine, glucose is a solute. Solutes attract water, so if you have excess glucose in the urine is going to hang on to more water. Those water molecules are attracted to the glucoses in there, so water is not reabsorbed as easily back out of the urine and into your body fluids. Okay, so that actually finishes out the chapter 25 content. We're not going to cover most of chapter 26, even though I would like to. There's a lot of good information in there about fluid balance. That's a really good chapter to maybe read through or hang on to your book and go back to that chapter when you're in nursing school or some other health sciences school, when the topics of fluid balance and acid-base balance and electrolyte balance come up. That's a good reference chapter. But we are going to, just due to time constraints, there's only so much we can cover in Biology 201 and 202. We're not going to be able to spend much time on that chapter. However, we are going to talk a little bit about acid-base balance in the body, and we're going to work on some acid-base balance problems. And this is a topic that does come up for nursing students, and it tends to give nursing students fits. So in Biology 202 here at Calhoun, we show you a method for solving acid-base balance problems. And hopefully you'll remember this when you're in nursing school and you're freaking out over acid-base balance. You can refer back to this information. I'll be posting a handout on Blackboard for you as well that we use in our classes here at Calhoun. And please keep this and refer back to it when you're going through this topic later in during your health sciences education, because I think it will help you. It will help you out. So that'll be the topic for lecture number 9.